Hello everyone, good afternoon. Myself is Dr. Purna Chandra. I am a consultant neonatologist and pediatrician at KIMS Cuddles, Secunderabad branch. Today, I would like to brief you regarding the care of newborn in the summer session especially, and overall the common concerns raised by some of the parents in routine day-to-day OPD basis. So the first thing that I would like to highlight is regarding the temperature. So many parents used to ask me whether they can use AC in summer or not, whether they can use fan or not. Since we routinely counsel the parents to keep the baby warm, so the answer is you can use AC or fan based on the requirement. So, but at the end, the baby should be warm to touch. Okay. So the recommended temperature is maybe you can use a AC temperature of 25 to 28 degrees centigrade approximately, and so baby should not be directly opposite the AC vent. You can keep the baby to the side, not exactly opposite the AC vent, and you can use the AC. So temperature is around 26 like that, and simultaneously you can use fan also if required. But at the end, if you touch the baby, so baby should be warm to touch. So routinely we say to touch the baby's tummy and baby's hands. So if you touch the baby's tummy, it should be warm, and simultaneously if you touch the baby's hands or soles also, they also should be warm to touch. Okay. The second thing is regarding the clothing. How much should we cover the baby? Okay. So baby should not be too much sweaty, or even the mother also should not be so much uh, discomfort should not be felt. Okay. So you can keep 1 to 2 layers of clothes, and you can always suggest the parents to use mittens, socks, and cap to the baby. Okay. So another concern is regarding the feeding. So always, wherever possible, use direct breastfeeding only. Exclusive breastfeeding is the motto. So that will be advised by every neonatologist or pediatrician. So suppose if the mother milk output is less, then only after after checking the baby's weight, and after checking the baby's urine output, then only if something we feel that definitely output is less and it is causing some concern issue to the baby, then only we opt for formula feeds. Okay. So how do you know that baby's feeding is adequate or not? Okay, because simultaneously there is a concern key baby may be losing weight or baby may be dehydrated, especially in the summer session. So how do you know that output is adequate? Okay, so whatever baby is taking, so that is adequate or not. So one indicator is regarding the urine output. How many times baby is passing urine? That is one indirect indicator. Okay, so we say at least 6 to 8 times per day is the routine norm. So if it is baby is passing more than 8 times in 24 hours urine, so that is almost adequate. Other thing is after taking feeds, so usually babies will sleep for 1.5 to 2 hours. So and the time duration of feeding session is at least 20 minutes, and we say to feed the baby on one side at one point of time. Okay. So another concern raised by the parents or attendants is, can we give water to the baby, because baby's lips feels dry. Okay. And mucosa seems dry. Okay. So but we don't say like, so water should not be used. Okay. So only feeds, either breastfeeds or formula feeds, other than milk, so nothing else. Okay. So the rationale behind it is, so in water there are no nutrients. Okay. So if the baby is simply drinking water, it may not add any nutritional value to the baby. So that is why only exclusive breastfeeding, or wherever necessary formula feeds, other than that nothing else till 6 months of age. Okay. And this 6 months also for the term babies. If it is a preterm baby, so the recommendations are different. So if the preterm baby, suppose the baby is born in 8th month, so that means baby should be fed with the mother milk till total 7 or 8 months, based on the how preterm baby is. Okay. So regarding the skincare in babies, because especially in summer seasons, so babies tend to have sweating, especially in the creases, like neck creases, okay, in the gluteal area, or in the thigh folds, and in the axillary regions, okay, and in the forearm region. So here, because of the sweating, baby tend to have some infection or some pustular lesions like that. So try to keep these areas dry if required. So by frequent cleaning of these areas, so you can keep these areas dry so that you can avoid infections or some skin related problems. So, and other concern is regarding the stool frequency and urine frequency. As I mentioned, urine, at least if the baby is passing 6 to 8 times per day, which is adequate. If and regarding the stool frequency, sometimes parents say baby is passing 10 times per day, or sometimes they may come with the concern that baby didn't pass stool for 1 or 2 days. Okay, so should we worried or not? So since they don't have the control regarding, actually in babies, they even in any human being, so we have some sphincters to control the stool output. So in these babies, that sphincter control is not so mature. With time, usually that maturity will happen. So what happens is, so even if after every feed, baby may pass some amount of stool. So that can be normal. That is called as gastrocolic reflex. So if the baby passing stool immediately after taking some feed, so that most of the times it can be normal. No need to worry. Okay, if the baby's weight gain is adequate, okay, and baby is otherwise active, and baby doesn't have any vomitings, and tummy is soft to touch, okay, then most of the times this is just a simple gastrocolic reflex and no need to worry. So sometimes baby may pass stool once in 2 days, 3 days, like that also. The baby is otherwise active, and baby's tummy is soft to touch, then I think we can wait for 2 days, 3 days, even sometimes we will wait for 1 week also. Okay, so it is more of habit rather than some pathological issue, majority of the times. So here are some questions. So one question is, what should my newborn wear in hot weather to stay comfortable and safe? So you use cotton clothes. Cotton clothes can be used in single layer, and they can be, with that, if the baby is comfortable, not so sweaty, they should be fine. So how often should we feed newborns in hot weather? So we say demand feeding. So whenever baby is asking, we should feed the baby. But otherwise, the ideal time is routinely, what we say is 2 hourly feeding. Okay, if the baby sometimes may ask even 1 hourly also. But if the baby is fed for at least 20 to 30 minutes, so baby should be sleeping for at least 1.5 to 2 hours. Sometimes this may vary from baby to baby also. So can we use fan, cooler, or AC to keep the newborns cool? So as I already mentioned, so you can use fan in 1 or 2 speed, and you can put on the AC with the temperature of approximately 26 to 28 degrees centigrade. So are there any specific skincare tips for by newborn in the summer? So routine emollient application, any moisturizer can be applied. Apart from that, as I mentioned, baby's creases should be kept dry. So with that, routine skincare will be taken care of. Sometimes what happens is babies may have some erythematous rash or slightly pustular lesions, 1 or 2 can be there. So these are some of the transient conditions. Sometimes baby skin may be so much sensitive. So because of this, these kind of rashes can happen. But with time, usually within next 2 to 3 days, these things will improve. If the issue is persisting, then better to visit the doctor. So are there any safety tips for bathing newborns in hot weather? Hot in hot water. So lukewarm water is what we recommend to uh, clean the baby or to do the bathing. So bathing time routinely, what we say is after removal of this umbilical cord, after fallen off, then it is the time to do bathing for the baby. Otherwise, before that, you can do sponging with the lukewarm water with a cotton cloth. So can we use skin creams for my newborn baby? Yeah, some moisturizer can be used to keep the baby's skin moist. So otherwise, other than this moisturizer, nothing else will be required. Before doing bathing, you can use some coconut oil to polish the baby's skin. So post bathing, after keeping the skin dry, you can apply some moisturizer. Are there any special precautions I should take when taking my baby outside in the summer? So preferably cover the baby, and second thing, you can use some umbrella to keep the baby away from this sunlight. So other than that, nothing specific is required. Hmm. So you can use umbrella while taking this baby out. So especially in the newborn period, we tend to avoid as much as possible to keep, while taking the baby outside. So if it is absolutely necessary, you can take the baby out. So avoid in the hot weather, and if you are taking at this point outside, then preferably you can use some umbrella while taking or carrying out the baby. So and so another concern raised by parents in OPD visits is regarding sunlight exposure in prevention of jaundice. So if you go by evidence, it is not evidence based. Okay, there is no significant improvement in prevention of this jaundice or prevention of phototherapy, but it is our age old traditional practice or cultural practice. So since it is a cultural belief, I recommend to expose the baby in the sunlight in the morning session. And another the concern with the sunlight is some heat rashes or some skin rashes can happen. If it is causing concern, then we can avoid exposing the baby to the sunlight. But if you go by evidence for prevention of jaundice, so it doesn't have much value. So another question is what we should do if newborns get heat rashes. So most of the times they will improve in next 3 to 5 days. If it is a pustular lesion, like if it is filled with some water, a fluid or pus, then in that case some topical antibiotics may be required. Otherwise, simple erythematous rashes may not cause a major issue to the baby. So most of the times it will improve in next 3 to 5 days. So another concern raised by parents is regarding weight gain. So how much weight gain is appropriate for the baby, and especially in the summer, some there is concern of dehydration and inadequate weight gain issues may be there. So ideal weight gain per day is 30 grams per day, usually post birth. So in the first 1 week to 10 days of life, they may lose some amount of weight because the skin is so immature, they don't have that much keratinization. So they tend to lose weight in the initial 1 week of life. So 1 to 3% of the 1 to 3% per day is almost appropriate. By 1 week of time, at 1 week to 10 days of time, babies will reach their birth weight. After that, they adequate weight gain is 30 gram per day. That means in a month, almost 1 kg per month. Okay. So regarding jaundice, so if you ask me, almost if 10 babies are delivered at one point of time, all the 10 babies will have some amount of jaundice. But only some few, probably 3 or 4 babies may require some treatment in the form of phototherapy or some intervention. It depends on the baby's gestation. It depends on the baby's risk factors like baby's blood group, mother blood group. If mother is Rh negative pregnancy, there is increased risk, and for mother blood group and father blood group, and is there any enzymes like G6PD deficiency, like that some risk factors are there. Based on the risk factors, day to day there are some nomogram cutoffs. So if suppose in the first day approximately 5 to 6 is normal for the baby, okay, so visibly yellowish facial discoloration, yellowish discoloration is normal. So on day 2 or day 3, up till abdomen, like till chest till abdomen, it is normal. If it is progressing to the legs and to the hands, then it means the value probably maybe around about 12 or above 14. In that case, intervention will be required. So so other question is, can diapers cause rashes to the baby? Yes. So if diapers are used and if the baby is passing urine and you have not observed, and timely removal of the diapers, timely changing of diapers is not done, so there is increased risk of diaper rash to the baby. So how to manage this diaper rash? So prevention is the most important thing. So avoid. How can you do that? By frequently changing the diapers or clothes that are being used. Whenever baby is wet under surfaces, undergarments, you have to remove it immediately. So after that, keep this area dry for some time. So after that, you can use some emollient like parachute oil, coconut oil, or some emollient moisturizer you can put. So so with these things, rash can be completely prevented. If happens, then also the treatment is the main these things only. So frequent change of diapers or clothes. After that, cleaning this area, keeping this area dry. After that, some emollient application, and still this rash happens, then some ointment like zinc oxide containing medications will help in early improvement of this rash. So how can we help the newborns sleep better in hot weather? So comforting the baby. So the ambient temperature should not be so warm, so you can switch on fan or AC to some extent, and you can make the baby calm. So, and other thing is, if the baby's tummy is full, so most of the times they'll sleep for 1 to 2 hours at least. So keeping this area comfortable and feeding the baby, breastfeeding will help the baby sleep in a better way. And sleeping pattern also in babies, usually what happens is in the daytime they predominantly will sleep, and in the night time they will be predominantly very active. So so what my sincere advice to the mothers out there are is, so you, whenever possible, you try to take rest in the daytime so that you can handle the baby in a better way in the night time. So this sleep wake cycle will be helps will improve by in the next 2 to 3 months of life. After 3 months they'll sleep for at least 2 to 3 hours in the night time. Otherwise, predominantly night times they will be very much active. So can we use a baby carrier or a sling in hot weather? Yeah, I think baby to carry the baby, they can be used sling. So they can be used, but my suggestion is, in the especially in the newborn or early infantile period, you try to avoid traveling as much as possible, and especially in the summers. So try to avoid the traveling, because there is increased risk of upper respiratory tract infections, also viral infections. Also, once baby catches cold or something, it is difficult to treat also, because in newborns or in the early infantile period, we try to avoid these cold medications as much as possible, because they may cause some neurodevelopmental impairments or some neurological effects in later life. So that is why we try to avoid as much as possible in the early infantile period. So, how much weight loss can be accepted in newborns? So, in the first 1 week to 10 days, approximately 5 to 10% can be accepted. If it is more than that, we see whether breastfeeding is appropriate or not. In spite of all the steps, still if the baby is losing weight, then we may consider adding supplementation in the form of formula feeds. So, thank you for joining us live. Thank you.